So this might be a bit controversial to say, but I've just finished 2 days of covering the emergency department at my hospital, and I really think people need to take better care of their health. This might be a bit controversial, but let me tell you about some of the cases I saw. So I saw a woman in her 50s. She was overweight. She drank juice several times a day, every day. She did no exercise. She was working, so she worked as a carer. And she ate, loads of carbs, potatoes, yam, banana, rice, bread, all sorts of things. She was telling me about her diet, and she came in with a blood sugar of 60, a blood sugar of 60, 60. So normal blood sugar is kind of between 4 and 9, and her blood sugar was 60. And we had to give her intravenous insulin to bring down her blood sugar and give her all sorts of injections, do all sorts of treatments. And she was in hospital, for ended up being a couple of days. But that sort of person should have gone to their GP every year from when they turned 40 and had a blood test to diagnose pre-diabetes, which probably would have been picked up. And then she could have made diet and lifestyle changes to reverse her pre-diabetes before she ended up in A&E with a blood sugar of 60, and she had kidney failure and all sorts of other problems. And I'm just staggered as to why in a country where we have free healthcare, where we live in, one of the biggest cities in the world, in London, where people are still ending up in A&E with, this was a diabetic emergency, where this could have been caught and treated and possibly even reversed several years ago. Like literally, I'm talking maybe a decade ago, she could have learned about her diagnosis, and treated and reversed her pre-diabetes if it had been caught. But instead, she ended up in A&E with a blood sugar of 60 and rampant, rip-roaring type 2 diabetes. And then I spent like an hour with her, about 45 minutes with her, going through diet, lifestyle. I opened a website. I showed her different meal plans, how much to exercise. And, this was really overwhelming. And this is exactly why I want people to reverse their pre-diabetes and type 2 diabetes. So don't rely on your doctor, don't rely on your specialist, don't rely on anyone. You need to take the onus, you need to take responsibility for your own health. If you have a family history of diabetes, you need to have a blood test every year. If your GP or doctor is not contacting you, you need to contact them. Put a date in your diary, get a blood test every year, check if you have pre-diabetes. The blood test you need to ask for is an HbA1c. Have that blood test every year, particularly if you're over the age of 40. If you are from a black or minority ethnic background, if you have a family history of diabetes, if you're overweight or obese, or if you've got other medical issues like blood pressure or cholesterol, you should be asking for an HbA1c blood test every single year, along with routine kidney function, hemoglobin, liver function. If you have fatty liver disease, for example, you should be having an HbA1c every year. So I really don't want to hear these excuses that you don't know or you've not been told. If you're watching my channel, then hopefully you are well aware of this. But even for people that are not, this type of information is freely available on the internet. And like this woman that I saw this morning, did she not know that juice and refined carbohydrates are bad for her? Like, what planet is she living on? I'm really at a loss. You can see how indignant and how angry I am. If you've got any questions or queries, then please comment down below. Save, share, and like for more. Many thanks.